It is easy to feel overwhelmed by everything we're hearing about coronavirus, with Italy's death toll surpassing that of China's at more than 3,400 people, with the U.S. topping 10,000 confirmed cases, many thousands more waiting for confirmation, and still so few tests, with the CDC warning that younger adults are being hospitalized with the coronavirus at much higher rates than expected, and with the State Department urging people not to travel abroad under any circumstances, issuing a level 4 do not travel advisory. But there are rays of hope, too. We learned today that the death rate in Wuhan is lower than we thought, closer to 1.4%. And for the first time, China says there were no new locally transmitted infections today. And as I'm sure you've seen, we're getting daily briefings from Donald Trump and his team on what they're doing to slow the spread of the virus.
There's never been anything like this in history. There's never been. Nobody's ever seen anything like this. But we're doing the right thing. We have to get rid of. Our big war is it's not a financial war. It's a war, and it's a medical war. We have to win this war. It's very important.
It is very important, likely the most important thing Trump will face in office, but he's certainly not the first president to confront crisis. Who could forget this moment from Ronald Reagan after the Challenger exploded?
This is truly a national loss. We've never lost an astronaut in flight. We've never had a tragedy like this. And perhaps we've forgotten the courage it took for the crew of the shuttle. But they, the Challenger 7, were aware of the dangers, but overcame them and did their jobs brilliantly. I've always had great faith in and respect for our space program. And what happened today does nothing to diminish it. We don't hide our space program. We don't keep secrets and cover things up. We do it all up front and in public. That's the way freedom is, and we wouldn't change it for a minute.
And while George W. Bush got his share of deserved criticism for parts of his response to 9/11, there were moments like these where he undeniably stepped up and united the country.
I also want to speak tonight directly to Muslims throughout the world. We respect your faith. The enemy of America is not our many Muslim friends.
So is Trump following in the footsteps of those before him? I'm joined via Skype by perhaps the man best equipped to answer. He served as an advisor to Reagan, plus Nixon, Ford, and Clinton. He's now with the Harvard Kennedy School and a commentator on CNN. Of course, that is David Gergen. We're also joined by David's daughter, Dr. Katherine Gergen Barnett. She's the Vice Chair of Primary Care, Innovation and Transformation, and the Program Director of the Department of Family Medicine at Boston Medical Center. David, great to see you. And Doctor, it's great to meet you. Thanks for being here.
Thank you.
We're both proud to be here.
Great. David, I want to start with you. You've lived through the best of times and the worst of times of presidents in times of crisis. Where does Donald Trump belong on that spectrum in these times so far?
Well, Jim, in fairness, we are in the beginning chapters of what could be a very long saga, so it's too early to make final judgments. It's clear that he has not found his voice and rallied the country in the way that, say, Ronald Reagan did or George W. Bush did. He hasn't united us. I mean, it's disturbing that polarization even comes into this. So Republicans, by and large, 2/3 of Republicans basically think this has been exaggerated by the press, and they're not changing their habits very much. And that's very different from Democrats, who are about 20%. But the bigger issue, and I'll be brief here if I can, the bigger issue is how well have we treated the people of America in terms of the patients and how many people are getting through this safely versus not. He did a good thing early on, deserved more credit for slamming the door shut on Chinese coming in. But since then, I'm afraid there's been a lot of bumbling and a lot of delays that are hard to explain. And Katherine is right there in the front lines, can tell you more about that, because I think that is what is the most disturbing. People may die unnecessarily on this.
Doctor, I do want to pick this up with you, is that we've talked a lot in the last week or so about the psyche of those who are sick, those who are worried about sick, but we haven't talked nearly as much about those who tend to them, like you. When you know that people in high places in Washington are not giving you what you need to do your job and often lying about that, how does that affect your psyche and the psyche of your colleagues?
Well, thank you so much for having me and for asking such important questions. First of all, just to kind of take a step back, I think, in terms of where we are in Massachusetts and what we're kind of looking at in terms of the future landscape, we have currently have about 250 plus positive COVID-19 patients in Massachusetts, and about 1,700 who are tested who are waiting for results. At the hospital where I work, Boston Medical Center, we have tested 59 people, or we're sort of suspicious that about 59 people are COVID-19 positive, and only one is so far positive. That being said, I think to your point is that we are actually really struggling very hard against a ticking clock, which is that we do not have adequate tests available for the hundreds of people who are concerned, who may have symptoms, people who are even in the healthcare field who have symptoms and yet do not yet fit the parameters for testing. And so as a physician and also as somebody who is really working hard to deploy residents who are in training, so I'm in charge of our residency program, I'm thinking a lot about how do I protect the people who are training to be young physicians when I'm concerned about not having enough supplies to protect them, the correct equipment, and when I'm also concerned about not having a good number of tests so that I can quickly figure out who's sick and who's not sick and who can stay in the hospital and who can go recuperate at home.
I want to follow up on.
Stressful.
I want to follow up on that question, though, Doctor, with you, if I can.
Yeah.
Talking about the young physicians who work with you, when that patient turns on the television, and here's a couple of weeks ago, there's a test for anyone who wants it, and it's perfect. And then they call the young physician who works for you and says, I want the test. The president told me I can get one. And one of your docs has to say, I'm sorry, you can't. What does that do to the relationship between patient and provider, that it seems to me that relationship of trust that is so critical?
Yeah, well, I think that probably it's very challenging for all of us, but the fact that the providers are having that very same experience where providers cannot be adequately tested through no fault of what's happening at a state level, I think that for providers to be able to share, I know that this is stressful and I know that you are worried. But for your sake, and because we don't have adequate testing, it's much safer for you to stay home and recuperate at home. I think, the bigger challenge for us as well, working at a place like Boston Medical Center, is recognizing that our patients don't necessarily have homes to be in. Right. And if they have homes, they're much smaller places where they can't actually be quarantined from one another, or certainly not isolated from one another. And then you have food insecurity and all the levels of job insecurity. So it is obviously very difficult to allay people's fears. But I will say that my residents and my colleagues have been just so inspiring in terms of the way that they have not only really leaned into the hospital and sort of providing care on all levels, but also really proactively reaching out to patients and thinking about the bigger social concerns and the health equitable concerns, social justice concerns that are happening for our city.
In light of what you said, I think you'll be happy to hear the next person I'm talking to after you two is Linda Downey, who obviously runs the Pine Street Inn. David, you said it's too early to judge on some counts the leadership quotient from this president. But I would have to say on one count, the jury should already be in. Here's an exchange today with Donald Trump with a reporter from the One America News Network. Please listen.
Do you consider the term Chinese food racist because it's food that originates in China or it has Chinese
No, I don't think it's
and
racist. I don't think it's racist at all.
On that note, major left-wing news media, even in this room, have teamed up with Chinese Communist Party narratives, and they're claiming you are racist for making these claims about Chinese virus. Is it alarming that major media players just to oppose you are consistently siding with foreign state propaganda, Islamic radicals, and Latin gangs and cartels?
It amazes me when I read the things that I read. It is fake news. It's more than fake news. It's corrupt news.
In one fell swoop, David, I would argue xenophobic, racist, and trashing the media all in one. And as you know, he has started, I think quite intentionally, 2 press conferences in a row in 2 days referring to this as the Chinese virus. That's about as unleader-like as you can get, is it not?
I totally agree with that. Listen, he engages in shifting blame on a regular basis, and he's now made the Chinese a scapegoat. And as you know, in China, they're calling this the American disease. And it doesn't help the people on either side. We ought to be in a highly cooperative relationship with countries around the world to see if we can end this crisis. We can find some way out. Can we find a vaccine? Can we find something else that will help treat people? That ought to be the common objective. And when you retreat behind national borders, as Donald Trump has done and as an increasing number of countries are also doing, what you find is it's going to be much more difficult to solve this problem. And when we wind up thinking that, we want to, the story that we tried to buy the vaccine from Germany and make it exclusively our own, that was extraordinarily distressing. That's not who we are as Americans. That's not the tradition of our past presidents we've looked up to. I do think that Donald Trump has made a big U-turn. And from first he was dismissive of all of this, and now he's at least moving in the right direction, and we need to give him credit for that. But he's doing it in such a way still that is, I think, tearing apart the fabric that has held the world together for so long.
One of the things that I'm not an expert on leadership, unlike you, David, but when a vacuum is created, and I would argue there has been a vacuum, others fill in. People like Governor DeWine, for example, in Ohio, who was the first to bar spectators from sporting events, the first to suggest that state colleges send their kids home. That's in the political world. But, Doctor, have you felt that the leaders in your community, medical leaders, have stepped up to the plate in ways that are needed by your patients and patients-to-be?
Yeah, thank you so much for asking. I mean, I will say I wholeheartedly agree with the need for innovation in leadership at times of crisis where people need to think outside of the box and come together with a greater mission and vision. And I will actually say, being part of multiple conversations with leaders around the country and really leaning into colleagues who are in places like Washington State, where they've been hardest hit, and saying, what's working for you? Let's think together. How are we actually going to work together to think about taking care of our patients and moving through this crisis together has been really heartening despite the very kind of dark and stormy days. I think those reaching out across state lines, reaching out across even specialties, and really thinking together about how we can deploy our current resources and think creatively about what we have, and then think towards the future when we know resources will be short and how we're going to care for each other.
David, one last thing for you. I read a quote from you in the Globe recently, and I'll paraphrase it, where you said it's very hard to teach leadership, but it can be learned. Can you give me an example of a president who, in your opinion, learned leadership at a critical time, who didn't get it before?
Well, there are many, but in Massachusetts, I think we should particularly remember John F. Kennedy. In the first 100 days, he had a Bay of Pigs, which was a gigantic mess. He realized he'd botched it badly. It got us in, it took us to the brink in some ways. But 14 months later, then we had, after the Bay of Pigs, we had the Cuban Missile Crisis. And by then, John Kennedy had grown into a much more substantial figure. He was on top of the presidency. He was inspiring. And he kept us, we came as close to that during that time, right to the edge of a nuclear war. And Kennedy deserves a lot of credit. And it was his personal growth in the job that made all the difference. And that's why, if you really want to test of a leader, it is how much do they grow in the job? Yeah. And that's a good test of a president. And one right now, I'm afraid our current president just doesn't have the grade we're looking for.
Before you two leave, how'd you like working with your kid, and how'd you like working with your father tonight? Yes?
Awesome.
Two smiles.
Yeah, thumbs up.
Yeah.
I loved it too.
Thank
David
you.
and Doctor, thank you both so much for your time. I appreciate it.
Thank you so much.
Perfect.
Thanks.
What a delight.